Today we'll talk about the utility of an anoscope within a proctologist office. Now, to differentiate it from a flexible sigmoidoscope or a colonoscope, those instruments are utilized to look at the rectum and the colon and to fill it up with gas so that it can be visualized. And they're longer tubes with complex monitors and systems hooked up to them. But as good as those instruments are for looking at the rectum and the colon, they actually don't do a very good job of looking at the anal canal. And that's because the sphincter muscles close up the anal canal despite utilization of gas to insufflate the rectum. So you don't get a very good look at what's going on in the area where hemorrhoids, fissures, fistulas, HPV, anal cancer may reside. As such, an anoscope is utilized to look at the anal canal, and this is a very common instrument that is very standard to a proctologist office and utilized on a routine basis. It's not a flexible instrument. It doesn't insufflate anything, and when used appropriately, it should cause minimal to no pain or discomfort. After appropriate lubrication, the anoscope is physically inserted within the anal canal to perhaps 6 centimeters or so. Then the obturator within it is removed, and this allows for direct visual inspection of the area of concern, as previously noted, where you can get a much better visualization of internal hemorrhoids, external hemorrhoids, potential HPV, anal dysplasia, anal malignancy, fistulous tracts, hypertrophied anal papilla, and all the other common maladies that are seen in a proctology clinic. Usually this procedure takes no more than a minute to perform, although sometimes it can take a couple of minutes, and it can also be utilized to help treat these maladies that are noted here, so that you can directly inspect and treat HPV in the area or internal hemorrhoids in the area. There's again, when used appropriately, as in you're utilizing the right anoscope for the right patient, and not doing anoscopy on individuals who are already in significant pain in the anal canal. When used in the setting where it's well tolerated, there's really no recovery associated with the procedure, and a lot of knowledge is gained out of it, which can then be discussed with the patient to help them better understand their pathology and make appropriate decisions on how to treat it.